Hello, I'm Amanda Tuura, Communicable Disease Supervisor with the Kenosha County Division of Health. Today we present the last in our series of frequently asked question videos focusing on the Kenosha County Kickstart plan that was released to the community earlier this week. The Kickstart plan includes advisory best practices for businesses and individuals and a phased approach in an effort to save lives while bringing back our economy. It is aligned with the state's Badger Bounce Back plan. The public guidance for all phases includes the following recommendations. Mask or cloth face coverings are strongly recommended for all public activities for anyone who can wear them, recognizing that with certain medical or physical conditions may not be able to. Physical distancing of 6 feet or more between individuals not of the same household. Continuation of washing your hands often with soap and water or the use of hand sanitizer, especially after touching frequently used items or surfaces. Avoidance of touching your face. Sneezing or coughing into a tissue or the inside of your elbow. Disinfecting frequently used items and surfaces, and people who feel sick should stay home. They should not go to work. They should remove themselves from congregate settings, especially if around vulnerable individuals or populations, and they should contact and follow the advice of a medical provider. We will move from the current phase to phase 2 when the following are sustained. A 10% decrease of influenza-like illness reported within a 14-day period, a 10% decrease of COVID-19-like symptom cases reported within a 14-day period, a downward trend of 10% or less with positive test as a percent of total test within a 14-day period, 95% of our hospitals affirm that they can treat all patients without crisis care, 95% of our hospitals affirm that they have arranged for testing for all symptomatic clinical staff treating patients at the hospital per CDC guidelines, and 10% decrease in cases among healthcare workers for 14 plus days. The public can view the plan on our website, kenoshacounty.org. And now here is Kenosha County Health Officer Dr. Jennifer Freiheit with the final message about COVID-19 in our community. Thank you.
Hello, Kenosha County, and thank you so much for bearing with us through this pandemic. Thank you for being safe, taking care of yourself and your loved ones, and we want to continue to encourage you to take this virus seriously and to remain as safe as possible. And the ways that you can do that are by wearing a mask anytime you're out in public, by staying home when you're sick, and that means even if you just have a slight sickness, like a tickle in your throat, mild symptoms that we normally used to power through and go to work with, this is not the time to power through that. We want to ensure that you stay home when you're sick so that we are not spreading anything throughout the community. We also want to make sure that you're limiting gatherings, that we're not going back to business as usual, because the virus is still very much here in Kenosha County. So we want to encourage you to remain vigilant, wear a mask, practice social distancing, keep your contacts limited to your household as much as possible, and to stay safe by washing your hands for 20 seconds and practicing good cough and sneeze hygiene into your elbow. And we thank you for everything that you're doing to help the rest of the community stay safe. If you are feeling sick, we want to ensure that you get tested. Please do seek COVID-19 testing, but be patient because results are now taking sometimes up to 7 days to get results back. And during that time, we do ask that you stay isolated to home until you do get your results. We also want to assure that you have the most up-to-date information and that you can follow all that transparent information on our Kenosha County Hub website, where we put the latest gating criteria and all the data so you can see where Kenosha County sits. Thank you, and we hope that you have a safe and healthy summer.